My name is Munirah binti Mansur. I am a final year student at UniKL Royal College of Medicine, Perak. I am in my final year of my Bachelor in Medicine and Bachelor in Surgery program. And my experience here in UniKL RCMP, I've almost come to the end of my 5 years. I am the pioneer, one of the members of the pioneer UniKL MBBS degree program. And my 5-year experience here so far has been definitely character building. It has been enjoyable. It has been, I believe, looking back, it's one of the best decisions I've ever made coming here to UniKL RCMP. I initially came from a diploma in science, and my choices then were quite limited because I really wanted to do medicine, and the choices in the public sector was quite limited. They did not accept diploma entries, so that brought me here. And among the choices in the private sector, UniKL RCMP was actually came along based on a recommendation from my father's colleague's daughter, who had actually was here previously, and her recommendations included the teaching staff were excellent, the learning environment was conducive, the facilities provided were aplenty, and so because of that, that prompted me to really focus and research about this place. And sure enough, when I did come here and enroll here, indeed I found that the teaching staff were very helpful, and the ratio of staff to students were a comfortable amount. We compared to my other friends in other universities, where I hear they have student numbers of up to 200 in a lecture theatre. Here in my class, we have about 100 students, and the numbers itself is helping because the lectures have more focus towards us. And the first 2 years here was my preclinical years, and after that 3 years were my clinical years. So for the preclinical years, basically the theory part, everything was good, the teaching and the learning processes. And then in the 3-year clinical part, the attachment was generally in the Hospital Raja Permaisuri Bainun, which I find that it was very lucky for us to be attached here because of the one, we are the only university attached here currently, and therefore we it's not so much crowded as with other universities, even though this is not our teaching hospital, but still by numbers we are not overwhelming the teaching, the honorary lecturers over in the hospital. And the staff there are committed and they facilitate as well. In the hospital there are abundant number of patients. That is never an issue, and the range of cases seen in all the departments, in all the wards, I believe that when I even compare myself to my younger sister, who is also a MARA sponsored student, but she is doing her studies in Indonesia, when I talk to her, when I go back home and we talk about our experiences, even she envies me because of the range of cases I see, because she, even herself being a student studying in Indonesia, the ranges of cases seen are different, and the exposure and how much the students are allowed to interact and manage the patients are different than us here. And of course the language is one important thing as well. And overall I find that coming to UniKL RCMP was the best decision I've ever made. And now that I'm expected to graduate soon, I only hope that this will prove to be true. My future plans after my graduation, which is not so long to go, I'm expected to graduate as one of the first MBBS UniKL students in about 3 months' time. definitely it's a given that I have to serve the government for my housemanship training, which will be for 2 years, and subsequently as a medical officer. However, I honestly, at this point of time, I don't see myself having a reason to leave the public service. I'm quite happy seeing the way things are going, being attached at the hospital here in Ipoh. I'm happy with the way patients are seen, patients are managed, the way doctors are able to treat patients, the so to speak freedom that they have. And so right now, at this point of time in my life, of course I am only looking forward to graduating well and starting my medical career, but I do intend to further my studies, to specialize. I'm not so sure yet, maybe something to do with surgery. But beyond that, definitely one thing for sure, I have right now, I find that I'm feeling quite comfortable to remain in the public service at this moment in time. And for specialization, that will come later, maybe after 5 years. I honestly have no definite future plans yet, but definitely I will further my studies and choose a specialty and or subspecialty. One other thing that I find has been a good learning experience here in RCMP, which has been conducive, is the exam system, which actually has a quite large part of a continual assessment, and so it doesn't put so much pressure on an actual exam where you pass or fail, and where you're continually assessed throughout the year. So that of course demands consistency on the part of the student. So when I compare myself to students from other colleges or from doing the same program, they usually are under higher pressure of performing for one singular exam, and as opposed to us here, which I won't use the word relaxed, but I would use but that sort of environment is more conducive for us to learn without pressure, and for us to know that if we perform consistently, which is how it's supposed to be, if we do perform consistently, then we will be rewarded appropriately during the exams.